Hey everybody, welcome to today's webinar. So today we are going to discuss depression. And I have a fantastic professional here with me, Danielle Howa Pendergrass. And Danielle, go ahead and introduce yourself.
I'm a women's health nurse practitioner. That means I'm a nurse practitioner who took some training, extra training, to specially care for women.
And what prompted this webinar is I posted about my own experience with depression on my blog, and it actually got the biggest response that I've ever had. I had the most reads and the most feedback. So with that, I decided I wanted to, get the opinion and the input and the perspective of someone that knows a lot about depression. And so I'm really excited to get your opinions and your perspective, because honestly, I didn't even know I had depression. And so that's where I wanted to start, was what some of the telltale signs of depression are.
So some of the signs would be if you're just not interested in what you used to be, if you're feeling kind of down and kind of in the dumps, you start to avoid people and events that you would usually attend. Difficulty sleeping or sleeping too much, eating way too much or not eating enough. Those are all some telltale signs that something's going on.
Yeah, and I know for me, I did not know I had depression. I mean, it took me forever. At first I just thought, oh, I'm just in a funk. And I kind of went through the list of A to Z things that I normally would, okay, we're going to get out of this funk in 3 months, and then we'll get on with life. And none of that was really working. And then, of course, I thought, well, maybe, it can't be postpartum depression because my daughter's 2. And so I just really didn't think it was depression. I didn't have a history of depression. And so, like I wrote in my post, the light bulb kind of turned on when, just talking to a friend one night, I realized, okay, this could be like on a chemical level. So just monitoring yourself. And honestly, it did feel a little different to me than a normal funk. I mean, not just that it was taking longer, but I just didn't feel like myself. And so, just really, and talking to friends about it, right? I mean, that's how I think especially we as women, really understand ourselves and know what's going on, is through conversation.
Absolutely. That is the most common thread among women. We need our friends. We need to be part of a group, and we also need to talk things out. And sometimes you can't see yourself or the things that you're doing, or the things that just don't seem right. And that's why our friends and family and those people we truly trust are important partners in our lives, to help bring that to our attention a little bit more.
Yeah, absolutely. So let's talk about medication. So talk to us about antidepressants, and how do you know, maybe just what are some side effects that you should look for once you do find an antidepressant that are not good?
Okay, so choosing an antidepressant, your healthcare provider will go through like what your signs and symptoms are, because choosing them, like if you have more anxiety coupled with the depression, mm-hmm. or certain other things going on, they will choose an antidepressant that will help you the most. In doing that, sometimes it can be tricky. It's like picking out like a good pair of jeans, and so you try them on in the dressing room and they look awesome, and then you get them home and wear them twice and you think, oh my goodness, why did I ever buy these? Antidepressants can be the same, and it can be a little bit tricky that way. So side effects would be to, like you had some heart palpitations, mm-hmm. that were going on, yeah. And so that's a side effect that is undesirable, so we would have you stop your medication. If you're feeling worse on the medication, mm-hmm. if you start to think suicidal thoughts, or your thought process are getting worse instead of better, that would be another reason to stop. And then if you're feeling absolutely no change, mm-hmm. that's a good sign that is either not the right antidepressant for you, or we need to increase your dose.
Yeah, and I felt really blessed. So she has a clinic here, and it's women's only. So women's only clinic. I came in. She's got a little bit of pink here and there, and it doesn't feel so clinical. She had me sit down on a chair versus on a table, to chat and to talk, and she spent a solid 45 minutes with me, and really asked what my symptoms were, what I was experiencing, and from there was able to give me medication, and I really, really appreciated that. And like she mentioned, the first one, I was having heart palpitations, and it took me a couple of days to put it together to realize, oh, that's from the medication. And so maybe just being aware of, once, I guess I wasn't really focused on, I was just glad to have a medication. So I think being more focused on and connected to, oh, this could be a symptom, and therefore I need to, change my medication. But then we changed it, and it was the one for me. So it worked out really good. So is medication, an antidepressant, something that you need to be on the rest of your life?
Not necessarily, no. So there's a couple different trains of thought with an antidepressant. Some people have a family history of depression, which that family history is no different than if you had like hypertension, if you had diabetes, or some other chronic health condition that way. So for some women, yes, you may need to be on it for a lifetime. Let's just compare that a little bit with diabetes. If you have type 1 diabetes where you need insulin, that would be the type of a person who, if they had depression or had a family history of depression, would need to be on antidepressants for their entire lives. Mm-hmm. Now let's take type 2 diabetes, for example, as a comparison. That is a different type of diabetes where we know that if you get on some medication and do all the other lifestyle modifications like diet and exercise, eventually you can come off the medication. That's the same with antidepressants. It takes about 8 to 12 months for the brain to heal from like an episode. So for those women, no, you don't have to be on them for the rest of your life. But I'm happy we have them to get you over that hump, yeah, and get your brain chemistry and body all situated. And then you would go off of them by tapering, and we monitor your symptoms closely. And if you're doing fine, then continue being off of them.
Great. Yeah, I really love the way you put that, because I think, honestly, myself, I did not think depression was really a real thing. I thought, come on, just figure it out. What's the big deal? And then I experienced it, and I had a very large piece of humble pie, because I know what it's like now. So first of all, it's okay to take medication for that. It's just like taking medication for diabetes or for anything else. It's something that you need medication for. But then also, you might not need it forever. I love that. And even if you do, it's okay. But like for me, I'm still on the medication that you prescribed, and I'll see how it goes. But just knowing that I might not have to be on it forever is a blessing. But like I said, it's there if you do need it forever, and that's also a blessing. Thank you. So let's move on to, so we're on medication, but what else? It's not just about medication. Medication can be there to help us, fix what needs to be fixed, but what else can we be doing along with medication to make sure that we are doing the best for ourselves?
That's a really good question, because medication can only do so much in really all aspects of health. Mm-hmm. So there are other things that you can do to help your medication to work, because sometimes it takes a little bit of time for antidepressants to kind of start to get into your system. So we usually say it takes about 6 weeks for you to notice your maximum effects. So other things that you can do as the medication is building and to help you throughout this time, mm-hmm, are exercise exercise
Yay.
increases, and Emily can help you with that, but it helps to increase the serotonin levels in your brain, the same chemical we're trying to help you to increase with antidepressants. So exercise is a key element in that. Also getting some exercise and outdoors and some fresh air and sunlight, being in nature, that always helps too. Diet is a huge component, because when we get depressed, we start to crave things like carbohydrates, cookies, cake, candy,
So true.
bread, pastas, things
Yep.
like that are going to increase our serotonin.
In large amounts.
Yes, because what it does is it really does increase our serotonin levels,
Mm.
and then as our body metabolizes it, then we have this steep drop off,
Okay.
and then we need to make sure that we get some more carbs in somehow. So we
Sure.
go back for me, it's a loaf of French bread that would really help
Yeah.
to get that craving. But and then we go back to it, and it's this vicious kind of cycle.
Right.
So really watching your diet, eating all of those good things that are healthy for us. So paying attention more to those things that are closest to their natural forms, and starting to limit those carbohydrates. Staying off soda is a big one, because it increases our blood sugar and then it decreases and it falls off, so it's a roller coaster ride. Also, eating small frequent meals tend to really help, because it stabilizes our blood sugar. And then also doing some downtime things, like yoga, meditation, taking time to write your feelings out in a journal. Spending time with your friends and family, and those people who really fill you up, not the people who suck your time and energy,
Yeah.
and just really picking and choosing who you spend your time with are
Great.
very helpful.
Yeah. Yeah, I've noticed that. I mean, maybe that's just my personality too, but I need downtime, especially like in the summer when it's kids all the time. Love my kids, but I've got to have that downtime to be able to function and accomplish the things that I need to do. So that's great. So then also, I've kind of heard, I don't know if it's true or not, you can tell me with your experience, but if there are like environmental things that can impact your brain chemistry to cause depression, such as elevation.
So I'm not aware off the top of my head of any evidence-based medicine that says that elevation would cause more depression. And there may be some really good studies out there. But there are some things behind that may be causing it, like maybe low iron or low hematocrit or hemoglobin. That could make you feel sluggish and kind of tired and sort of out of your sorts, and we know that can be a problem at higher altitudes. Also, some other underlying conditions that you may or may not know that you have. A thyroid condition could make you really feel tired, have some weight gain, just not feeling like yourself, because that is an actual hormonal imbalance. Also, problems with your hormones, severe PMS, things like that can be corrected with some birth control options to see if we can balance out those hormones a little bit. So those would be some things.
Great. Yeah, and I was also going to ask you about birth control. You just brought it up. So that can also aid in balancing things out.
Absolutely, because with a non-hormonal, like, let me rephrase that. With a natural cycle, our hormones are going up and down. They're ebbing and flowing. And so sometimes with depression, it's that roller coaster that is really difficult to deal with. Hormonal contraception can sometimes balance out those hormonal patterns so that you don't get that 2 week ahead of time PMS where you feel terrible and your symptoms of depression exacerbate. So sometimes that can even it out a little bit.
Oh, that's good to know. That's great. So let's also move on and talk about pregnancy and breastfeeding. So, you know, we as women are having one or more children often, and what if we have these symptoms hit us in the middle of a pregnancy? Or what if we have these symptoms hit us while we're trying to do, you know, what we may feel like is best for our baby and breastfeeding them?
So it's not uncommon for depression to hit during pregnancy or in the postpartum. So we recommend seeking treatment
Mm-hmm.
for that. If you are on some type of antidepressants prior to getting pregnant, we recommend that you continue the antidepressant therapy throughout your pregnancy.
Okay.
Or if you're not feeling like that's the best thing for you, talk with your healthcare provider and kind of weigh the risks and benefits for your unique situation. So you can decide if you want to stay on or to discontinue. If it hits you during pregnancy, then absolutely seek help. And help would be antidepressants, but also therapy. That is one thing I forgot to mention in those other things that you can do. Studies show that talk therapy, which along with medication, really increases your success rates in recovering from depression. And then also, if depression hits you in the postpartum period, it is absolutely imperative that you seek help. So my guidance in that area would be, find somebody that you trust. I don't know if it's your friend, your husband, your mom, your mother-in-law, whoever that may be, to kind of tell you that you're not really being yourself. Because sometimes with everything that goes on with bringing a new child home and all of those other things that we have to balance as women, sometimes we can't see that we really are sinking into a depression.
Yeah.
So you need to have that person just kind of say, hey, are you okay? Have you talked with your healthcare provider about this? So
yeah, and I know with my experience with myself, I started feeling all these things I needed to unload and talk about throughout that dark period in my life, but at the same time, I was reasonable enough to think, but that's not fair to my friends, and that's not fair to my husband. And so I realized, okay, I need to seek out a therapist, because that's what therapists are for. And I did. My therapist actually referred me to you, and that's what I needed. I needed the therapy, I needed the medication, and that's what got me through.
And I'm so glad that you did seek therapy, because a lot of people wait to seek it.
I did wait. I picked up the phone and set the phone down lots of times, because I thought, I'm an independent person, I don't need anybody else. But in this case, you need other people, and it's important. Like, the sooner the better, right? As soon as you think, oh, these might be symptoms of depression, get help right away.
Yes, because remember, it takes some time for the medication to work, if that's the avenue you choose to go.
Right.
But talk therapy is always there. You're always working on something. So it feels really good to go in, let it all out, have somebody's objective opinion, because they don't love you and care for you and want to help you emotionally, like your family or friends or mom or whoever that is. You can just kind of go dump it. They'll give you some things to work on. You close the door and move on with your life.
Yeah, and then I also found that throughout the next week before my next appointment, I was making notes, and it really caused me to think about what I wanted to talk about in my next session. What are the things that I need to get off my chest? What are the things I need to work on? And so, yeah, it was very, very beneficial. And I don't know, I think that's another thing, that don't feel like you have to do it forever, right? I mean,
absolutely
for
not.
me, I started going once a week to therapy. I needed it that much. And then as I worked through things and was on the medication and everything, I did it once a month. And then from there, I just kind of did it as needed. And so, I mean, maybe even all of us should do it twice a year, because it's a great thing to have.
I think everybody in a perfect world should have a therapist on speed dial that you could just go in and let it all out.
Yeah.
But unfortunately, though, women will not seek therapy, and they'll come in and want a medication. But it's that therapy component as well as the medication that is really going to get to the core of the issue and help you to heal.
Yeah, that's great. Well, is there anything else that any other insights that you can give us?
Just do not wait. Do not suffer, because it's not only you suffering, it truly is your family, it's your partners, your children, your parents, those people out there who love you, who just want to make sure that you're okay. And it's not a sign of weakness.
No.
it is a sign of strength. It is a sign that you know and understand yourself enough to know when you need help.
Exactly.
And I don't want you to be intimidated. All healthcare providers are there to help you and to understand exactly what you need from us.
Yeah.
And we want to give you the best care that we could possibly give. So don't be afraid. Don't be intimidated. And if somebody comes in to me and says, I'm struggling with depression, I think, good for you. You're self-aware enough to know. And I'm proud that you made it in.
Yeah, absolutely. Well, those of you that are watching that live here in Carbon County, Utah, I just wanted to give Danielle a chance to let you know where she's located, her phone number, because I highly recommend her services. She is really good at what she does.
Thank you so much. So I own and operate Eastern Utah Women's Health. We're located at 77 South, 600 East in Price, Utah. Our phone number is 435-637-0313. And you can follow us on Facebook at Eastern Utah Women's Health and go to our website, easternutahwomenshealth.com. And don't be afraid to reach out either to me or to anyone else to get the help that you need.
Yeah, well, thank you so much. I really appreciate your professional insights on everything. Like I said, I wrote a blog post about it, but that's as far as I can go. All I know is my own experience. So I appreciate you telling us and giving us all the information that you did. And thank you for joining in on this webinar, and we'll catch you next time.